Great. Well, welcome everyone. Thank you so much for being here today, for joining this incredibly important event at a time when healthcare is just a critical issue for our country. My name is Matt Sinovic. I'm the executive director of Progress Iowa. We're a statewide issue advocacy group that really likes to talk about and engage people on a number of important issues. And today we're talking about healthcare with one of our terrific national partners, Protect Our Care. And this year, our healthcare is on the line, our lives are on the line, and healthcare is on the ballot. So we really want to make sure that people are have every bit of information that they need to get this to before they go into the voting booth. What's at stake, and what how their vote might impact their health care and their lives. So this is the Your Vote, Your Health, Your Vote tour, one of several stops around the country that Protect Our Care is doing. And so we're honored to be the local partner for this event here in Iowa. We have a great lineup of speakers today, including Senator Tom Harkin, who you'll hear from next. But before we and two registered nurses, Ann Rhodes and Dr. Jane Hawks, who will be speaking as well. But before we dive into that, I want to just paint the picture of what we're dealing with here in Iowa and across the country. And we have a president and a Congress who campaigned on and promised to repeal the Affordable Care Act. That's their goal. And we're so honored to have Senator Harkin here, because we're going to hear some of the history about about how that law came to be, just as a great refresher and reminder, and the importance of that law. But they have been working since day one to take that law away from us. And we'll learn more about what that means to everyday Iowans, to people from Dr. Hawks and Ann Rhodes later as well. But the big picture, the numbers are that would mean more than 200,000 people just in Iowa would lose their health coverage if that law was taken away. It would also mean more than 8,000 Iowa veterans would lose their health care if that law were taken away. And there should be no doubt about their intention. President Trump campaigned on this issue. Repeal and replace Obamacare, repeal and replace Obamacare. It was their mantra. He's not saying that very much anymore, I think, because the law has become more popular and people understand what's at stake. But that's what they promised. That's also what Senator Ernst promised when she ran. And she has since voted 4 times to repeal the Affordable Care Act, 4 times to take away health care from all of those thousands of Iowans. And now there's a lawsuit that will be heard before the United States Supreme Court 1 week after the election, and likely just a few weeks after this latest Supreme Court nominee is attempted to be confirmed. The lawsuit is attempting to repeal the Affordable Care Act. So they weren't able to do it by passing the votes in Congress. They passed a tax bill that took away the individual mandate, and now they're trying, as part of that ACA, and now they're trying to repeal it in court. So these next few weeks, these next few months, whether we're in election season and casting our ballot, or paying attention to what the court is or isn't doing, it's such a critical time for our healthcare. So this discussion could not come at a better time. So we're going to hear from our speakers now, and then we're going to have I think a little bit of time for question and answer at the end. But I want to thank you all again for being here today. If you're watching on Facebook, please like and share this video, because that helps us spread the word about this important discussion. So go ahead and share that video right now. And I have the honor today to introduce a great friend of every Iowan, still someone who I wish was my senator, and a champion for healthcare, for working families, and for so many other things, our friend, Senator Tom Harkin. Senator Harkin, thank you for being here today.
Well, hi, Matt, and thank you, and thank Progress Iowa for your advocacy and support, not just in healthcare, but for a more fair and just society. This is certainly true in the area of healthcare. We must continue to advocate for healthcare to be an inherent human right and not a commodity whose availability is based on wealth or social status. Now, a little bit of history about my involvement. For 30 years in the Senate, I served on the Health Committee. And for 25 of those 30 years, I either chaired or was a ranking member of the Appropriations Committee that funded the Department of Health and Human Services, the National Institutes of Health, and the Center for Disease Control and Prevention. Upon the death of Senator Kennedy in 2009, I assumed the chairmanship of the Senate Health Committee. So I chaired all the hearings and the markup, the drafting of the Affordable Care Act, and brought it to the floor of the Senate, where, as you know, it passed. So I have been involved in this issue of healthcare for well over 30 of my 40 years in the US Congress. I want to say at the outset that when we were developing this legislation, Vice President Biden was there by our side every step of the way. He sat in on a lot of our meetings, urging us on, helping us to form coalitions, overcoming obstacles. So he knows this law. He knows the background, he knows its involvement, its history, and the evolvement of it since we passed it in the Congress and President Obama signed it into law. The goal was very simple of the Affordable Care Act, that every American, regardless of income or health status or zip code, would have access to affordable, dependable, quality health care. Well, when I brought this bill to the floor of the Senate, I gave a speech. I referred to it as a starter home. In fact, a lot of the press picked up on that at the time. It became quite a popular phrase around 2009, 2010, 2011. I deemed it that because I knew it wasn't complete. There were other things that needed to be done, but we had to get a start, and that we would add on to this home, add the rooms and different things onto it as time progressed. So I referred to it as a starter home, but basically we delivered on our basic goal. 23 million Americans now covered. And as you mentioned, 227,000 Iowans. Insurance companies cannot deny or charge more because of any pre-existing conditions such as diabetes or disability. No co-pays or deductibles for preventative measures such as your annual checkups. Children can stay under family policy until they're age 26 so they get through school or early work experience. And I might just add, this provision that we put in on pre-existing conditions is going to be even more important coming out of COVID-19. We have learned, at least I have from CDC and others, that even young people who have gotten COVID-19 and recovered may have some lasting health effects, such as lung scarring, some heart problems, maybe some autoimmune deficiencies going forward. If we lose the Affordable Care Act, they will then be subject to higher insurance premiums or maybe even a denial of health insurance in the future. So again, so important that we don't allow the Affordable Care Act to be done away with. If President Trump is successful, all of this is going to go away. And quite frankly, we can't permit that to happen. So while I've said recently that Trump and Biden may be the names on the ballot, what's really on the ballot is healthcare and the future of healthcare for all Americans. Now, there was one, I just want to mention one thing. There was one room, if you might take my analogy a step further, that we wanted to add on to this starter home, and that was something called a public option. Now, again, because of the way we had to craft the legislation and get it through, we couldn't get it on. But it was always our goal that at some point we would have a public option. So important, for example, for people in Iowa who live in rural areas, who are in the individual insurance market, who pay through the nose exorbitant rates for less than actually good coverage, but they have no other place to turn to. If we had a public option, they would have some competitive edge then. They could go somewhere else to get their health coverage. So important for people in Iowa, especially in small towns, farmers, rural communities. Well, Joe Biden has committed himself as president that he will work with Congress to get that public option put on the Affordable Care Act. So vitally important. So that's why it's so important that Biden is our next president, and why we need a Democratic Senate that will help him put that additional room onto the Affordable Care Act. Again, this is one of the major issues of our time. We cannot afford to go back. So yes, healthcare is on the ballot. And as Joe Biden is president of the Democratic Senate, we'll make our starter home of the Affordable Care Act a complete house of healthcare for all Americans. Thanks.
Senator Harkin, thank you so much for speaking out today, for your continued leadership on this, and just your continued advocacy. We need it more than ever. We need to be reminded of it more than ever. That's why Protect Our Care is doing this Your Health, Your Vote tour across the country, and trying to spread the word about it. So we know we have to keep reminding people that if you want healthcare, like you said, to not be a commodity, but to be something that everyone has access to, then we have to vote. We have to make sure that we tell people the importance of it. So thank you so much for doing this today, and for all you're doing.
Thank you. For sure.
Up next, we have some brief remarks from Congresswoman Cindy Axne, who is not able to join us today, but was able to send in a recorded message. So we are going to, assuming that this all works, I'm gonna play that now, and we are going to hear from Congresswoman Cindy Axne.
Hello, everyone. It is so great to be with you all today. And thank you to Progress Iowa and Protect Our Care for putting this together. Look, healthcare is on the ballot this year, folks. We have a choice to make. Are we going to support our seniors, our families, and people with pre-existing conditions, or will we abandon them in the middle of a global pandemic? For those of you who don't know me, I'm Cindy Axne, the first-term representative for Iowa's 3rd Congressional District, running to be your Congresswoman again. I'm a 5th-generation Iowan, small business owner, and proud mom to 2 teenage boys. And before coming to Congress, I spent a decade working in state government under both Democratic and Republican governors. I got into this race back in 2018 because, like many of you, I was frustrated that we had a government that wasn't listening to everyday Iowans. Our representatives were voting to take away health care for millions, give tax breaks to the wealthiest earners, and even passing legislation that made outsourcing American jobs more lucrative for big corporations. We needed our government to work for us, not the special interests. It's been 10 years since the passage of the Affordable Care Act, and the Republican Party is still committed to erasing its legacy, dismantling protections for pre-existing conditions, and kicking millions off their health care. We can't afford to move backwards. I'm sure many of you, like me, remember what it was like before the ACA. When my husband and I were starting our small business, we couldn't get maternity coverage as part of an individual plan without an expensive rider that you had to be enrolled in for at least a year prior to pregnancy. Frankly, I don't know what's worse, pregnancy being considered a pre-existing condition, or the idea that women should be expected to know their reproductive plans so far in advance. But when my second son was born, the only way we could afford to give birth in a hospital was to sell our personal belongings on eBay. That was 15 years ago now, but I hear stories like mine every day. This should never happen in America. Every family, every woman, every person deserves quality coverage they can afford. It's unfathomable that we're still having this conversation in 2020. Over the past 2 years, I fought to pass important pieces of legislation that strengthen the Affordable Care Act, reduce the cost of prescription drugs for our seniors, and defend protections for pre-existing conditions that have been under attack year after year. But we need to keep the House, we need to flip the Senate, and we need to elect Joe Biden and Kamala Harris. Healthcare is on the ballot, and I'm counting on each and every one of you to commit every bit of time you can this month to help us get that vote out. There's a lot of work to do, but we know we're in this fight together, and I know we can succeed. So send in those mail ballot requests. Make sure your friends and family do so too, and sign up to help volunteer with your local Democrats in your community. 34 days left, Iowa. Let's get to work.
Well, thank you so much, Congresswoman Cindy Axne. We are really grateful to have her leadership in Congress and her support for so many Iowa families who need that access to health care. As a reminder, you're here with the Your Health, Your Vote national tour. This is the Iowa stop on that tour, sponsored by Protect Our Care. My name is Matt Sinovic. I'm the Executive Director of Progress Iowa. We are thrilled to have you watching today and participating in this discussion about why healthcare is on the ballot this fall. We've already heard from former Senator Tom Harkin, and we're about to hear from two really wonderful health professionals in our state. But as one more reminder, please like and share this video. If you do that right now, it will help get this discussion out to your friends and your family and really get them this important information, because we are, as Congresswoman Axne just said, we are just a few weeks away from the end of election season. And I call it election season now instead of election day because people are voting all over this country, and soon people will be voting in Iowa. Absentee ballots are about to go out in the mail next week, so people will be able to return their ballot soon. So it's all the more important that we keep talking about the importance of healthcare right now. Up next, our next speaker is Ann Rhodes, who's a registered nurse and a clinical professor at the University of Iowa. And I'm excited to turn it over to you to learn more about what your take is on what might happen if the Affordable Care Act is repealed, and just what Iowans are going through right now as it comes to their health care. So Ann, thank you so much for joining us.
Thank you, Matt. I'd like to talk about three things very briefly. The first is some numbers. The second is a little bit about pre-existing conditions. And the third is talk about other provisions of the Affordable Care Act. First, if the Affordable Care Act goes away, almost 200,000 Iowans will lose their health care coverage. 200,000, and that's a very big number. Another big number is 1.3 million. That's the number of Iowans with pre-existing conditions who will no longer be covered by health insurance. Pre-existing conditions. I'm a neonatal critical care nurse, or I was a few years back. I took care of babies. And a lot of the babies I took care of were premature babies. Premature babies, once they're born, have a condition called prematurity. And that means they are premature for life. Considered a pre-existing condition, and that gives them a life sentence of being uninsured. I also took care of a lot of babies who had very minor cardiac anomalies, which were corrected immediately after birth, and after that they were normal, healthy babies. However, being born with even a mild congenital heart defect, which was corrected, made them have a pre-existing condition which lasted for life. So babies were labeled with a pre-existing condition that lasted their entire lives. And they were denied health insurance, sometimes even on their parents' policy, for their whole lives. There's nothing more pre-existing than something that you have from birth. So being denied insurance because of a pre-existing condition is a very, very big deal. And the definition of a pre-existing condition is so broad that it includes not just prematurity or congenital birth defects. It includes things like asthma, pregnancy, a broken bone when you were a kid. It's very broad. 1.3 million Iowans have pre-existing conditions. And that's something that has been targeted in all of the bills that were proposed to replace the Affordable Care Act. Pre-existing conditions were excluded. The third thing I'd like to talk about are the other provisions of the Affordable Care Act. Most of the attention is paid to covering people who need health care, and I think that's absolutely the top priority. But nobody pays attention to the fact that there are dozens and dozens of provisions in the Affordable Care Act that focus on primary care, wellness, and prevention. And these are things that strengthen the health care for everybody in the country. And I have a couple of examples. One is that the Affordable Care Act provides for a free physical for Medicare recipients 65 and older. And a member of my family went in for one of the physicals provided for under the Affordable Care Act, and they spotted lung cancer. And this was recognized very, very early, and he's now undergoing treatment. And the fact that it was identified so early before there were any symptoms means that his prognosis is really very good. Wouldn't have happened except for the physical made available at no cost under the Affordable Care Act. Another provision that people don't pay a lot of attention to is one requiring transparency in nursing homes. If, for example, you're looking at a nursing home to place a parent or a grandparent in, the nursing home under the Affordable Care Act is required to disclose its history of violations of federal standards. It's also required to disclose its history of infections so that you will know the quality of the nursing home that you're looking at to place a family member in. There are lots and lots of provisions in the Affordable Care Act aimed at improving access, quality, and primary care for everybody, not just the uninsured. And while the focus is, as it should be, on providing care, health care for people who need it, there are a lot of pieces of the Affordable Care focus on improving care for everybody. And those will also go away if we don't have the firepower on the Supreme Court and in the legislature and in the presidency to protect the Affordable Care Act.
And thank you for those remarks. And I was saying to our speakers before we came on this, before we started, that I was hoping to, I hoped or expected I would learn something today, and I did. I had no idea that there was that requirement for nursing homes to disclose all of that information. And I mean, frankly, it's almost one of those, to me, it's one of those things that I'm shocked that it was ever not the case that they would be required to disclose that information. I mean, that's something that you want to know. Anyway, thank you for speaking today. Thank you for sharing all that information. We truly appreciate it. For those of you watching online, we are this is the Your Health, Your Vote Iowa stop on the national tour sponsored by Protect Our Care. My name is Matt Sinovic. I'm the executive director of Progress Iowa. We've heard from Senator Tom Harkin, Congresswoman Cindy Axne, and Rhodes, and we're about to hear from our final speaker in our program today. But if you have a question that you'd like to submit, I think we'll have just a few minutes for a couple of questions. You can make it in a Facebook comment right now, and I believe we have people monitoring that to send those questions in. If you're participating on the Zoom event, you can type it in the chat box, and we'll look through some of those after our final speaker here. So wanted to let you all know that as well. We have one more speaker, and it is Dr. Jane Hawks, who lives in Underwood, Iowa, and she's also a professor of nursing at Nebraska Methodist College. Dr. Hawks, thank you so much for joining us today and adding your voice to this important effort.
Thank you, Matt. I'm thrilled to be a part of this. Everybody has kind of touched on a lot of the things I was going to mention. So at least we're all on the same page in terms of the importance of the Affordable Care Act and maintaining that coverage for millions of Americans and certainly for Iowans in particular. I think most people and most Iowans that I've talked to don't really understand the ramifications of losing the Affordable Care Act and its protections. And I'm constantly trying to educate people about that in terms of, as we know, pre-existing conditions, preventative health care, and all of those things that Anne really covered very, very well. The other thing is that the Affordable Care Act goes far beyond covering pre-existing conditions and preventative care. We have accountable care organizations that have developed as a part of it to encourage transitions of care from acute care, intensive care to long-term care. And a lot of those organizations are really getting up and going, and we would lose the benefits of that if we lose the Affordable Care Act. The other thing is many of the recommendations of the Affordable Care Act are embedded in healthcare, and it would really put the nation in chaos in terms of healthcare during a pandemic if the Affordable Care Act was repealed, because we have nothing where there's no other plan, there's no backup, there's nothing for that. So the chaos that could ensue at a time when Americans need healthcare most is very frightening to me. And I teach a healthcare finance class, And most of the students now understand the importance of making sure patients have healthcare for all. And these are master's students. So we're looking at different models of healthcare delivery, including how Denmark, a lot of the Scandinavian countries provide healthcare for everybody. Germany has a slightly different model, but we look at all of those different models as ways that we can further improve healthcare for Americans and cut costs, because we all know Americans per person have higher healthcare costs. And it's not so much that it's related to the healthcare itself, but it's the fact that as I talk to physicians, many of them have to hire 15 or 20 people in their offices just to do the insurance claims. So having a healthcare for everybody, and maybe having it be more of a public option. Certainly, I don't have any problem with people keeping the health insurance that they have, but everybody needs to have access to health care. One of my students recently was involved in a project where they were having to schedule mammograms 6 months out because free mammograms are part of the Affordable Care Act. So as part of her improvement project in working with the preceptor, they put together a way to shorten that wait time for getting in to do mammograms. And so I think it's important to realize that a lot of people are getting mammograms now that would not have gotten them but for the Affordable Care Act, making that a provision of their care. The other thing is we're doing so much with community health centers and preventative care with the Affordable Care Act. There've been a lot of grants. We've got a lot of wonderful community healthcare delivery places. We're keeping people in their homes because we're providing senior services. There's just so much that's a part of the Affordable Care Act that would be lost. And I just don't feel, as I talk to people, that they truly understand how tragic that this would be for our country and why it's so important for us to elect Biden and Harris, and also to get a Democratic Senate in control, so we can really move forward with this. The Republicans have not proposed any kind of plan. We don't even have a plan for testing for COVID in this country. And as it was pointed out, we have a lot of people with COVID now who will have pre-existing conditions. And so it's really, really important for us to maintain healthcare for all Americans and all Iowans. Thank you.
Dr. Hawks, thank you so much for speaking today, for adding your voice to this. We really appreciate you being here and taking the time to do this, and for offering to or being willing to speak out. So at this point in the program, we've had our terrific lineup of speakers, and I know we have at least one question for our panelists. So I want to jump right in there before offering up some concluding thoughts. I know that Senator Harkin, you touched on this a little bit, and Dr. Hawks, you just mentioned this too. But this question was for all the panelists. If the ACA is eliminated, how could Iowans who contract COVID-19 or are suffering from longer-term health consequences because of the virus be affected? And so whoever wants to take that, I'll offer that up.
I'll start. They might be eligible for Medicaid, but if they're not eligible for Medicaid and they don't have employer-based health care, they would be uninsured. And if you're an uninsured patient, you get billed for services at the full amount of the cost of services to a hospital. And it's very complicated, but hospital charges are quite variable. Hospitals negotiate charges with insurance companies. So the charge master fee, the fee that is public, also under the Affordable Care Act, hospitals had to make, effective January 1st, a year and a half ago, they had to make public their charges. And it's hard to get at, but it is available. But the full fee is negotiated down with healthcare insurers. So what you actually pay is not the listed charge if you're insured. The only people who get charged the full cost are people who don't have insurance and they have no one negotiating a lower fee on their behalf. So if you're uninsured, you get charged the full fee. And if you're uninsured, there's no way that you can afford to pay hospital costs. If you walk in the door to an emergency room, that's going to be $5,000. If you're hospitalized for one day, that'll be $10,000. And you can probably add about $5,000 a day after that. And if you don't have insurance, you will be responsible for paying those for that care. Prior to the Affordable Care Act, one of the major causes of personal bankruptcy was medical bills. And we would be going back to that if we don't have the Affordable Care Act.
I have a follow-up question to that based on what you were just saying, for Senator Harkin or for Dr. Hawks, who I didn't teaches a health finance class, so I remember this discussion prior to the ACA becoming law, where if someone were to be in that situation, go into the emergency room, let's say, and have a $5,000, however, whatever the bill would be, and they're not able to pay it, my understanding was that that's something that drove up healthcare costs for all of us. Is that either Senator Harkin or Dr. Hawks or anyone answer that? Is that right?
Yeah,
Absolutely,
that is right.
Because the hospitals have to absorb that cost. So, that's why, sometimes if you really look at an itemized bill, you might get charged $6 for a box of Kleenex. Well, what do you think why are they charging that? That's how they make up for some of those things. I've had students share with me that they're still paying for the delivery of a baby 2 years ago. They're on the payment plan. They're having to pay $25 a month or whatever it is that they owe. And they had health insurance through a public school system. So, and they still had so much out of pocket that they had to pay that. Now, they didn't have to declare bankruptcy, but having a baby is normal. It's part of life. You shouldn't have to be, making all of these payments for 2 years, to cover the costs. So, it's very scary to think about what can happen. Senator Harkin, I'm sure you can add something to that.
It's called cost shifting, where people with insurance, the charges for people with insurance are increased in order to cover the people who are uninsured or people who pay less than the actual cost of services.
Right.
And all hospitals engage in this in order to make sure that they make enough money to continue their operations. Even nonprofit, not-for-profit hospitals and healthcare centers have to bring in more money than they spend in order to continue operation. So they have to balance the debt that they have with paying patients. So they have to manage their money their charges in order to bring in more than they take more than they spend. And so if people don't pay their full bill, that money gets shifted to people who pay.
I will also note that most nonprofit hospitals also are associated with foundations. So they're constantly raising money. And a lot of those funds are used to help people who maybe need assistance in paying their bills. They can pay part of it, but they can't pay all of it because it's a financial hardship for them. And that typically ends up being our elderly who are on fixed incomes, and Medicare doesn't pay everything. And if they don't have any secondary coverage, they can be in trouble with that too. So there are a lot of different programs for that, but it would be catastrophic if everybody needed assistance with that.
And I think it's criminal that elderly people have to rely on charitable foundations to cover their health expenses.
Right. I agree.
Listening to you two experts, it just reminds me again that during all of our hearings on the Affordable Care Act and on the health insurance industry is how complicated it was and still remains. a Byzantine network of different kinds of insurance companies, exclusions, and insurance companies, of course, what they want is they want to divide the populace up so that they get the healthiest and best people in their insurance program, so they can collect the premiums, but not pay anything out. Uh, and so, what we tried to do in the Affordable Care Act was again to try to break down some of those walls, those exclusions, because we all understood, and as we understand today, there's one principle of insurance that is inviolable. That is the principle that the more people in the pool, the cheaper it is with more coverage for everybody. Once you start dividing that pool up, then you break down that system. So that's one of the things we tried to do in the Affordable Care Act was, again, to try to make that pool bigger. And so that the pool just didn't have healthy people in it, but it had the broad spectrum of people. That's why we did away with pre-existing conditions as a basis for both either coverage or premiums, cost of the insurance, was to bring everybody more or less into that pool, and to provide a kind of a what will I say, a balance, a kind of a competitive balance, or at least where you could look at one insurance program, see what their cost was, what their coverage, and then look at people under the Affordable Care Act and see what their coverage was like and what their costs were like, so that you could have a good a measure of how things were performing. But in order for that to happen, we still have to expand the Affordable Care Act and cover more people. And that's why we need to have that public option that we tried so hard to get in the initial bill, but we still don't have. I'm convinced after 10 years now that more and more people understand that. And that's why I believe with Joe Biden as president, with the Democratic Senate, within a very short span of time, we will have that public option. Everyone's going to be better off with that.
Well, thank you, everyone. Thank you, Senator Harkin. Thank you, Dr. Hawks. Thank you. And I think we are actually over our time for this stop on the Your Health, Your Vote tour. But this has been such a great discussion, and I'm glad we got to the point of mention the point of the I wrote it down of cost shifting, because to kind of hopefully sum it all up here, I mean, we have Iowans believe we have this belief that we want to take care of each other, that neighbor to neighbor we help each other out. We've seen that through floods. We saw that earlier this year through the derecho storm. We see it in our healthcare. It's why after the ACA passed, we had a Republican governor and a bipartisan vote in the legislature to expand Medicaid. Some states are still waiting to expand Medicaid, but we did it here on a bipartisan basis. And but even if that's not enough to drive it home, it really does impact your own pocketbook and your own family's finances if everyone doesn't have health care, so or access to health care. So I hope this was as informative and interesting for everyone watching on Facebook and on Zoom as it was for me. I really enjoyed learning from all of you today. So once again, I just want to thank Ann Rhodes, Dr. Jane Hawks, Congresswoman Cindy Axne for delivering her remarks by video, and of course for Senator Tom Harkin, you for joining us today, and all of you for speaking out. This has been the Your Health, Your Vote tour. If you want to continue following along the virtual tour, you certainly can, even if you don't live in the state where it's at. And so if you follow Protect Our Care on Facebook, you can do that. If you want to get more information about how to vote, there are only a few weeks left in election season. Follow in how to vote in Iowa. Follow Progress Iowa on Facebook, Twitter. Sign up for our email list. You'll get all kinds of great information about how to exercise your right to vote. We hope you do. We encourage you to vote. And of course, remember that, as Senator Harkin said, it's not just the names on the ballot. This year, healthcare is on the ballot. So Thank you again, all of our participants, our speakers, our co-sponsors, and thank you all for watching today.